Lovely, thank you. Thanks, Naji. So I'm here, as Naji says, I work for the Applied Research Collaboration. Professor Naji Tebbett is the theme lead for one of our core themes, Living Well with Dementia. And I'm here to talk about research implementation and impact. So the Applied Research Collaborations are part of the National Institute of Health Research, sort of, the umbrella organisation for research in England. And the applied research really is about responding to and meeting the needs of our local populations and health and care systems. So it's characterised by building on the findings of basic research and building solutions to specific problems in the health and care system. So this is really important. I'm sure you're all aware that a lot of health and social care research doesn't reach or benefit the system that it was designed to help. And that might be because it didn't ask or answer the right question, because it wasn't a priority for the health and care system. And they are, as I'm sure you're all aware, really struggling, and really we do need to be supporting priorities if we want to get our research findings heard and implemented. Sometimes it might be it takes too long. The system's working very quickly, responding to quick changes. So if they're waiting 3 years for a result that they need a response to they need to find a solution to in 6 months, they might have moved on, and it might be quite difficult then to change, in the next sort of when those research findings become available. Sometimes it's because it was never designed to be usable or implementable. So it might be, might be your discovery basic research. So it'd be the first step, but then also sometimes the findings are just not accessible or reaching the right stakeholders. It might also be because recommendations cost too much, and it also might be that it requires significant change that the system can't accommodate. Just a little bit about implementation. So implementation is, well, the National Institute of Health Research is trying to sort of standardise the way it talks about dissemination and implementation. And they've kind of categorised it into 3 ways. So one is sort of diffusion of passive activities, which might be sort of your publication in a medical journal, but also trying to make those a bit more accessible and available to the general public and other audiences. But then it might be a more active approach of spreading those research findings to a much more targeted audience with using planned strategies. And then the sort of more implementable and impact driving, I suppose, approach is knowledge mobilisation. And not every approach will be right for every piece of research, but this is about adapting and understanding what your research is, the likely impact it is going to have. And implementation involves implementation science or sciences. There's lots of approaches to how we might implement, but I think they are all very dependent, again, on what the question is and the setting we're trying to apply it into. We've got lots of tools that we can use to support implementation, but I would really suggest that really key to this is relationships, understanding the system that you're working in, trying to use non-academic language when you're working with the healthcare setting, and particularly non-professionals who are in the healthcare setting. It's about networking, understanding and embedding priorities and how the system is working, and also engaging with the public and communities and co-producing with them and building on communities of practice which would bring these people together, our key stakeholders and our public people using the services. And ultimately then impact is going to go beyond that academic impact and that publication in a prestigious journal. It's also beyond those activities to implement. It is really demonstrating change in understanding behaviours, interest, and also change in policies, priorities, processes, pathways, and recommendations within the system. In the Applied Research Collaboration, we've got we've got an implementation strategy, which is really about hearing the needs of the system and the people accessing services, and feeding that back into our research activities, with the overall aim of obviously improving services. I am aware of time's out and I'm aware I'm running through these, but I want to give you some examples. I'm just going to start my video as well because I realise I'm off video, so apologies about that. In the ARC, we with each study that is funded or supported by the ARC, we now develop an implementation plan, and that looks at system priorities and the priorities of our research organisation. But also we do prioritise studies that have been developed with users of the system that have a health and social care economics evaluation, because then we have more assurance about cost effectiveness and also have that implementable output. So our plans will consider this alignment to those priorities, but also consider what our target audience will be, whether we can get rapid insights out before, perhaps rather than waiting 3 years for a study to complete. Are there other time points within that study where we can get insights that help the system in the meantime? What types of results are generated, the expected impact, and what type of implementation we're going to need to do, and also building that resource and cost from the outset. So I'm going to give you 3 examples. Do tell me if I'm running out of time, Angie. So one was and in actual fact, Dr. Steph Daly was talking about the Time for Dementia study. In response to COVID, we very quickly pulled together a study to approach families on the Time for Dementia study to see how they were responding or adapting to COVID. It was a really pragmatic study design. By definition, it was a COVID study. We wanted really rapid insights to inform the system. Another study run through the Centre for Dementia Studies called Determined also did a very similar sort of quality of life COVID study looking at the impact on people living with dementia and their carers. So we were able to combine those findings and in the end have 350 families that participated in this research, which I think is fantastic. We again, we spoke, Julia spoke earlier on in the day, and her group, her lived experience group, was really actively involved in this study. And between us, we developed some key messages and findings that we shared with the system. And you can see a picture of some of these. There were literally 5 groups of messages. And we tried to make these as accessible as possible to the system. And they were disseminated nationally. They've been shared on the NHS Futures site, which is a big sort of depository of research and best practice that the NHS uses, and it has been, and its impact already has been that it has informed regional dementia and carer strategies as well as workforce activity. There are links, when you get the slides, there are links to these. We also very quickly, in response to COVID, undertook a study looking at remote memory assessment, and again there was very I'm sure you're aware of severe disruption to services. Memory assessment services were closed, and there was a real pragmatic response by the system to try and deliver some of these services remotely. But there was a lot of uncertainty about whether that was effective and how that would land. So this study looked at patient and clinician satisfaction. Again, we had really active lived experience involvement, and the implementation of this was really through the University of Sussex. They funded a toolkit, a video and a patient information sheet. This has been presented internationally. Again, it's been shared on the NHS Dementia Futures site, so it's got national scope. And then we held a community of practice or launch to launch the toolkit and the findings from this. I'm not going to show you a clip of the video, but there are links to the video and the toolkit in the slide pack that you'll be able to access. So we know we've had 50 downloads. We are about to reach out for actual impact, see if this has actually changed people's practices, but we do anecdotally know that it has changed the way people have approached delivering their memory assessment services based on the feedback from this research.
A remote appointment means you can stay at...
And then finally, you heard from Rafi earlier on today, Rafi Faruqi. We've got a PhD student who's also a consultant psychiatrist at Kent and Medway Partnership Trust. He's doing a PhD looking at alcohol and dementia and ARBD. And this was really coming up as a priority within the system. It's a really challenging problem for the system. There's a lack of understanding about the condition and the prevalence, there's significant unmet need, and within the region, so that when I say that I mean Kent, Surrey, Sussex, people were developing their pathways as well. So there was a lot of interest in sharing these findings as soon as possible. So this was his first year evidence synthesis, so not his entire research study. So we combined Rafi's BJ's evidence synthesis with speakers like Rafi and a couple of other clinical academics who did a sort of 2-hour presentation for service, and we had 170 attendees to this, which I think was really impressive, a national attendance that was from across the UK. As a result of that, and bearing in mind this is early, we don't want to preempt BJ's research or his publication, but we were able to develop some key messages, which again you can download. And again, these have been, we've been asked to share those on the Dementia Futures site. And this is really the start of knowledge mobilisation. So we've been asked to do more communities of practice, again, from a national level. And that is exactly what we'll be doing. But it has already started to inform alcohol and dementia strategies and ARBD strategies. So I'm going to stop there. There are links when you get the presentation. There are links, so please do take a look. Real whistle-stop tour, but just hopefully an idea about how we can try and get findings, early rapid insights, early findings into the system to support them as quickly as possible.
Kath, many thanks. We are really lucky here in Kent, Sussex, and Surrey, because we have a new but very active ARC. Applied Research Collaboration for the region, and then Kath is the implementation lead and so on. So yeah, so thanks a lot, Kath.